Good morning, good afternoon, everyone, and thank you for joining the promotion series on Commission Officer Effectiveness Report, specifically for supervisors. My name is Robin Davidson, and I'm the Acting Director for the Division of Commission Personnel Support. I wanted to let everybody know that this is being recorded, so if you can mute yourself, please do. So the topics we're going to go over today is really what the Commission Officer Effectiveness Report is, the timeline for the 2024 season, what specifically is the supervisor's role in the COER, the different elements of rating and how we rate our officers, just a few tidbits of do's and don'ts, and then we wanted to talk about the rebuttal process and the complaints and redress process, and really what that supervisor's role is in both of those processes if it does come to fruition. The Commission Officer's Effective Report is similar to a PMAP for our civil service. It is a web-based product that evaluates the officer's performance, duties, and proficiencies throughout a given period of time. That period of time runs from 1 October to 30 September every year. And the specific accomplishments that officers put in it should be to that specific rating period. If it is anything outside of that rating period, then we'll go ahead and go back to either the officer or the supervisor to say, you might want to modify this to get it within that rating period. So the timeline for COER officers is that annual COERs start every fiscal year. So 1 September, it actually opens up for the officer to be able to start working on listing out their duties, their goals, and their accomplishments within their COER. Once that COER is submitted by the officer, it goes to the supervisor. And the supervisor from 31 October to 30 November, you have an entire month to start working on those comments, those ratings for the officer during that rating period. After the supervisor finishes their portion, it goes to what is called a reviewing official. The reviewing official's role is to look at the overall perspective of the officer and to provide how they are working within and outside the agency as a COER officer. And lastly, it goes to the officer, and the officer has an option to either concur or non-concur with that COER. Even if an officer non-concurs with the COER, there is a process outside, and we'll talk about it a little bit later, on that rebuttal process for the officer and a complaints and redress process that the officer has to take. And lastly, our regional liaisons are the final signature on every COER that is produced in the Indian Health Service, and they're required to submit it by 15 January of 2024. If an officer or supervisor transfers anytime during that period of time, what we can do is called an interim COER. It's very similar to an annual COER, depending upon how much time the officer has been either supervised or in that position, will determine whether it should be an interim COER or will act as their full annual COER for that year. But the regional liaisons can definitely help both the officer and the supervisor determine if that's an appropriate action to take. So what is the supervisor's role when it comes to the COER? First and foremost, it is most important because it weighs the heaviest when it comes to promotions. So the COER itself and the accomplishments of the officer's duties in their primary job counts for 40% of their promotion. So what you put in this COER is very, very important to our promotion board members and to the promotion process. We really want supervisors to focus on the narrative and not so much on the score. The driving factor behind it is the comments that you put to support your rating when it comes to the different sections. And really that secondary assessment includes the review of the COER score and then the context of the officer's performance or trends. So it is really important what supervisors write in that COER is the driving force behind what it comes out on those promotions. We really want to document professional development and contributions to the agency mission. So the COER is really focused on how well the officer is doing their job, both internally and externally, based upon the position that they're attached to or assigned. Now, if an officer is in an acting role, and not part of their primary position that they're attached to, officers can provide accomplishments in that acting role in their accomplishments. And I encourage supervisors to include not only their primary position, but what the officer is doing in those acting roles as well, because it is part of their job or part of that responsibility that we as an agency is asked the officer to do. In addition, we ask supervisors to go through those accomplishments that officers have written, because truly in the end, that is the driving force of what has accomplished. Now, I will say we've encouraged officers to have what we call a cheat sheet, a brag sheet, so that they know what they've done throughout the year and kind of those impacts and accomplishments they've done. It's a significant help for us as supervisors so that we know and we can rely upon supporting the structure of what we rate that officer on. Is because we're going to go back to those accomplishments. But there are other things that supervisors for us have noted throughout the year, including emails or congratulatory, thank you for that appreciation of what the officer has done. Those are types of information that we can include and support the rating that we put in that COER for our officers. And really, we want to evaluate the officer's performance objectively. The entire period of time is what we're considering when it comes to those ratings. I will say it's human nature. We all kind of mess up one time or another, but we really need to look at the officer's whole year on what they've accomplished, not just a very finite one-time accomplishment. I will also encourage supervisors to look at how it impacts the responsibility, potential. What is the officer doing above and beyond what just their position requires them to do? Are they leading efforts? Are they being part of the service unit committees that provide critical information to our patients, to the service unit, to the area? You can always think small, but you can also look to see what is that impact across the board. So there are 7 elements of ratings for officers. The first one being leadership. Leadership really demonstrates and communicates the vision and sense of purpose that the officer is doing and how they nurture that environment in accomplishing that organization's mission, depending upon where that officer sits. The initiative and growth really recognizes the acts on programmatic and personal development needs, resulting in the advancement of programmatic goals and growth in their professional skills. Communication is really that clear and concise written and verbal messages that are appropriate to the audience that the officer is actually presenting to. And really, it goes even further to how do they listen and understand information from others? You know, we are very patient focused. So listening to those patients, understanding what their concerns are and how are we addressing those concerns. Senior leadership. You know, if you're sitting in a committee meeting for a service unit, how are you listening and understanding that information is being conveyed? And what are those challenges? How are those officers overcoming those challenges in listening and understanding that information? Interpersonal skills is really facilitating those relationships, both internal and external to the service unit, in a manner that motivates others. You're really focusing on maximizing their abilities, their skills, their knowledge to really affect change and outcomes. Again, this could also be internal to the service unit or external to the area, to the nation, to IHS as a whole. So really looking at that participation in activities, that collaboration, and really understanding the respect, the friendliness, the appreciation, even sometimes humor and empathy to give that positive outcome. Planning and organization is really balancing workload and ensuring that timely accomplishments of projects, multiple and changing priorities, that the officer is really looking at that collaboration with not only their supervisor, but others in their work center. Referencing back to committees, how well do they plan and organize committees and making sure that that information is shared clearly and concisely. Professional competencies is really demonstrating their professional skill, knowledge, skills, the function to serve in that position. Really, it's also positive to say, what could they expand on? What could they do better? Is there classes? Is there an opportunity for them to learn and grow in those professional competencies to support what they do in the position that they're assigned to? And lastly, that analysis, judgment, and decision-making is really identifying and considering information in order to reach sound conclusions. And going one step further is taking the appropriate action when you do that analysis, judgment, and decision-making. It's really that logical reasoning, using of resources wisely, and timely and accurate decisions, really opinions thought by others. Do we have an officer that everyone tends to gravitate towards because they really want their advice or their opinion when it comes to certain situations? And lastly, the overall effectiveness. This really is a holistic picture of the officer. How well does their performance impact the program in their current position? What impact do they have to the service unit? What impact do they have to the agency? And really, what impact do they have to the nation in what they're doing? To continue with the elements of rating, there is 3 overall performance based upon those 8 elements, and it is a satisfactory, a marginal, or unsatisfactory. If an officer is rated as a marginal and unsatisfactory, again, I'll reemphasize for supervisors, ensure your comments support that rating. Because really, we want to make sure that the officer understands here's the areas they need to improve. But let's go one step further. For supervisors, if you put it on their COER, then let's have a plan of attack for that officer to help them grow, to help them become a better version of themselves, to support the needs of that position that they're sitting in. And what we provided is a 1 through 7 scale in each of those elements of rating. And what we put in here is kind of where each of those numbers fall. 1 being they need improvement in every one of those 7 elements of rating. 2 needs improvement in most areas, although they are successful in some, but in most, they probably need some improvement. 3 needs improvement in some of the areas. 4, they meet your intent, your expectations, and they meet the minimum requirements for all 7 of those elements of rating. 5, you meet and exceed in some of those areas for that officer. 6, you meet or exceed in most of those areas, but there are areas that maybe we can tweak, maybe we can work on to really make it focused for that officer. And lastly, the 7 means they exceed and go above and beyond your expectation as a supervisor and the expectation of that position. So a few do's and don'ts for supervisors. Provide detailed examples or comments with each of those performance attributes. Provide regular feedback to the officer throughout the year. I think that is critical for us as supervisors because it helps mold that officer to understand, hey, this is the area that we need to work on or we need to refocus on. Let's work towards that towards the end of the cohort. And then really it does not surprise the officer as to the rating that they receive. And then really we want to emphasize the narrative that you put, those comments that you put have to support the rating that you're putting them in for. So if you do mark them as a 3 or 2, be explanatory on exactly why, what areas they need to improve on. Is there examples that are critical throughout the year that has been that common theme for that officer that they really need to work towards? So we want to make sure that whatever narrative we put in, that it's going to support that rating that we have for the officer. Just a few don'ts we want to include is don't generalize your statements or add fluff words. We really want to be clear and concise in supporting the ratings for our officers. And I'll have a few examples that we can go through that are good examples and probably not so good examples. Do not put any comments regarding the officer's disciplinary or medical information in the COER. We will return it to have you remove it. It is part of the COER that is not appropriate. And then really in the end, as a supervisor, when you do start to receive these COERs through the system, if it's not who you're supposed to rate, reach out to your regional liaison. We can reassign that COER to who it does need to go to versus just rejecting it, closing it all together. Just reach out to us. We're more than willing to do the research along with the officer to see where it needs to go. And that way it can be rerouted to who needs to do that rating. So the rebuttal process. So after the COER is done through your process and the reviewing official's comments have been established, it goes to the officer and the officer has a concur or non-concur on the COER. We have emphasized to the officer that that concur or non-concur should not stop the COER. The COER still needs to be submitted. However, the officer first has an option to do what is called a rebuttal. And it is through the same exact electronic platform that the COER is attached to. If the officer disagrees with either the COER score or the comments within the COER, they can submit a rebuttal. And that rebuttal is really are due to the officer. They have to submit it within 90 days from when their COER actually hits their permanent record. After the officer submits their rebuttal through the electronic process, a copy of that rebuttal will be sent to both the rater and the reviewing official. Both entities can either submit individual rebuttal statements, or they can do a combined rebuttal statement on top of it. And what your comments is in that rebuttal is to support or emphasize, giving you a little bit more room to write. Your emphasis to why you marked or the comments you put in that COER. It is really that substantiated information that you are providing to the promotion board, but also an extension of the promotion board to the COER and to the liaisons as to why you marked the officer the way you did. Once it's submitted, that rebuttal will go behind the officer's COER and it will be in the officer's permanent record. If the rater and the reviewing official provide those comments, they will also go behind that rebuttal from the officer and it becomes a completed COER at the very end. So complaints and redress is separate from the rebuttal process. So if they go through the rebuttal process, they've come to you and said, hey, I disagree with my COER. Here's the reason why. They can have one final step, and that is called the complaints and redress process. The complaints and redress process is very specific as to exactly what they can complain or ask to be redressed. It is discretionary acts or omissions of the supervisor or senior official that have a direct or adverse effect on the officer or in violation of law, executive order, regulation, or policy. It is beyond the legitimate authority of the supervisor or senior official. It's construed of arbitrary, capricious, or the abuse of discretion, or it is clearly unfair. It cannot address any disciplinary actions. It cannot address work environments. It cannot address the position itself. It is very specific as to what an officer can complain or redress on. If an officer does decide and would like to pursue that complaints and redress process, your regional liaison will walk you through as the supervisor step by step on that process. So if you do receive a complaint and redress, absolutely reach out to your regional liaison. They will help you walk you through that process. Again, Just like the COER and how you put the very specific comments to support the rating, you want to do the same thing in both the rebuttal and the redress process. You want to be very specific as to exactly why you marked or the comments you made were the what you did. So just a few examples that we wanted to share with supervisors that we've seen over COER time. And they are in different sections of the COER. Leadership, demonstrated ability to foster relationships and partnerships with both tribal and state agencies. Through this partnership, the programs under his direction have expanded services to patients, notably expansions included mental health services, mobile clinic services, and testing, vaccination, clinical services. So that really supports that leadership aspect because you're demonstrating what the officer has done, not only expanding services, but going one step further as to what services were expanded. Communications. Significant role in compiling reports and conducting critical reviews for the compliance-ready laboratory. This includes health and governing board reports, quality reports, and joint commission readiness documentation. He leads the review with leadership and provides an exceptional oral response to a wide range of questions from a diverse audience of professionals. So this really supports that communication aspect of the officer, not only looking at it from a written perspective, but also then going with a review of the leadership and providing that exceptional oral response, then gives that verbal confirmation to that rating. Interpersonal skills. Ability to navigate executive level and national level leadership is that of a mature leader. She is the clinical director of the largest rehab program. I will say it's good. It could use a little effort, but it's definitely, it shows that interpersonal, not only from the largest rehab program, but the information that is shared based upon the executive level and national level leadership that officer is involved in. Analysis, judgment, and decision-making. Possess a thorough knowledge of the facilities management, real property program operations. He uses his knowledge and the data available to provide excellent leadership and sound guidance to the service units and area staff. When confronted with an obstacle, he will always consult the relevant knowledge base and take a calculated, logical approach to find a solution. So really that talks about, that sound conclusion, taking the appropriate action, and really looking at that logical reasoning and use of resources to make that timely and accurate decision. And lastly, overall effectiveness. Distinguished officer leaders within IHS HQ recognizes the skill set and application to improve 5 special projects that will benefit IHS. Really focusing on what does the officer do for IHS? What does the officer do for their position? And how do they help our communities continue to grow and improve? So just a few examples that need some improvement. The first being planning and organization. Excellent at time management, goal setting, prioritizing, and establishing realistic timelines. So in the blue, we kind of asked some questions that would probably better expand upon this statement to better support the rating and provide some sort of justification or influence to that supervisor's writing. What specifically did the officer do? Did they reduce wait times? Did they increase patients being seen? What did this apply to specifically? Is it overarching just time management as a whole? Or was it to a very specific set of changes that the officer did to then create better time management? And did they lead a project? Was this time management, goal setting, prioritizing, or establishing that realistic timeline? Was it in conjunction with leading a major project for that service unit? For interpersonal skills, ability to navigate executive level and national level leadership is that of a mature leader. And going back to the good example, and could use some improvement. So what skills did the officer use to provide that executive or national level leadership? Who are they involved in? Who are the key players? Was it internal to IHS? Was it external? Was there a sister agency that they were doing this executive level or national level leadership with and in partnership with? Did they collaborate with multiple agencies? Those are all things that we can emphasize to show that leadership, that growth, the communication, the interpersonal skills to that officer, both internally and externally to the agency. And the last one was professional competencies, graduated 4.0 with a doctorate of public health. Now, again, COER is focusing on the position and the role that they're serving in their job. So if an officer gets an advanced degree, you need to tie that advanced degree to what did it help in that position or program? You know, for a graduate with a 4.0 with a doctorate of public health, did they take what they learned in their DPH program and did they apply it to and create a new program within the service unit that provided additional uh, additional time for patients, or it increased funding, you know, grant funding to a position or to a section within a facility. You want to tie kind of what those statements are and how does it apply to the officer's position itself. Thank you for joining us. I hope you appreciate the presentation and really that kind of overarching, what is the supervisor's role when it comes to the COERs and how we can help you. We'll pause right now and then we'll open it up to any questions. Feel free to either put your questions in the chat, or if you want to raise your hand or come off mute, it's perfectly fine to do that as well.